in listen-only mode.
Hi, everyone. Thanks for joining us this afternoon. The title of today's webinar with Diable is Why Love Notes Works as a Relationship-Based Pregnancy Prevention Program with Dr. Anita Barbee. Joining me today in this broadcast is our webinar organizer or wizard behind the curtain, Kathy Guidry.
Thank you. I don't think you've ever introduced me that way.
Just came to me. So let's give you some information, though, in case you run into any problems. You can access the audio through your computer and also on your phone. So you have this phone number should you lose your connection on your computer. So you might want to jot that down. That also was in your invite as well that you received from us. There are several ways to participate. We really invite you to participate. We will have some poll questions for you that we're going to be asking you to answer directly on your screen. You can type questions in your question box, but I want to caution you with that. While Anita is talking and doing her presentation, I advise that you jot your questions down on a piece of paper. And then when the question and answer segment at the end of the webinar comes up, if you would enter them into your question box. This makes it much easier to pull those questions and responses from you up for Kathy to put them out for answering. Now, also, this webinar will be archived at as you can see, the website below. All our webinars are archived, and that'll probably happen at least 2 days after the broadcast. So as we continue on, I want to first mention that there are quite a few various types of organizations that are represented here today. We have a lot of healthcare, health, community agencies, and also high school teachers, family and consumer science teachers, hospitals, universities, 4-H, extension people, and a wide range of other people. And many I recognize and many I see as new people. So I want to take just a minute or two of your time to introduce Diable to you so you have an understanding of who we are and where we're coming from. This picture is Charlie Diable with his wife Helen. Yeah, there really is a Charlie Diable, and that's who our organization is named after. Charlie was an aeronautical engineer, a problem solver, to say the least. And in his retirement years, he worked with youth in his church. And he heard so many of their stories about their family issues coming out of families either separating or going through the process, divorcing, whatever. And so he became very concerned about the future of family given the situation with divorce and marriage at the time. And at that time, in fact, it was divorce was coming to one of its peaks, and that was like in the very late 80s, early 90s. So as a Mr. Fix-It, he began to do research and found that there was very little being done. And so he did recognize or find a family and consumer science teacher who was doing work in relationship education right there in Redlands where Charlie lived, and that was in California. So now, and next slide please, 20 years later, we are a national independent nonprofit based in Berkeley, California. Our materials helped organizations much like yours, and we have served over 170,000 youth and young adults in the last 2 years nationwide. All our materials are research-based, and the program Anita is speaking of today, Love Notes, is now recognized as an evidence-based model. Next slide, Kathy. It was developed by Marlene Pearson, who also developed Relationship Smarts Plus and Beyond My Reach, which maybe some of you have used her other materials as well. Next slide. The Diable Institute basically believes in stable, healthy families. Don't we all believe in that? And isn't that what we want for our communities, for our students? We are not anti-divorce. We recognize that sometimes there are marriages that just are better off if the parents separate. What we are, though, is pro-healthy co-parenting in that case. We are definitely anti-violence. And we also believe, next slide, that all people deserve respect and that all relationships can be improved with relationship skills. So our programs reflect this belief everywhere that it is possible to show the various, or to speak to the various issues of relationships. So let's get started with Dr. Anita Barbee. Just as an intro, Anita has an MSSW and Ph.D. and is a professor and distinguished university scholar at the Kent School of Social Work at the University of Louisville in Kentucky. She received her Ph.D. from the University of Georgia in social psychology. Over the years, she and her team have secured really $33 million in extramural funding from numerous local, state, and federal agencies. And with that, she was able to develop and execute and evaluate training and to build capacity in family and youth, serving organizations to improve policy, practice, and outcomes for families, youth, and children affected by trauma. She joins us today because of her work as the PI on an Office of Adolescent Health Tier 2 grant from 2010 to 2016, which involved love notes, and of which she will talk about this afternoon. Now, as a reminder, before Anita starts, have a pencil and paper handy so that if you should have any questions on her presentation, you can enter those in at the end of the session. And with that, I want to gladly introduce Anita to you and have you enjoy the broadcast. Thanks, Anita.
Thanks, Irene. I appreciate that introduction. I'm excited to be with you all this afternoon to talk a little bit about the study that we did on love notes and some of the reasons why we think it was an effective intervention to prevent teen pregnancy. So that's just our intro slide there, and Kathy's going to turn to the next one. When we started down this road, certainly we had known that teen pregnancy rates had been dropping. They've been dropping a huge amount over the last 25 years, except that some groups still remain high in their teen pregnancy and birth rates. Some of those high-risk groups include African American youth, Hispanic Latino youth, foster youth, and LGBTQ youth. And so because there are still some pockets of vulnerability in our country and in our state of Kentucky where we conducted our study, we wanted to focus in on these youth, if at all possible, in our approach over the last few years. So next, I'm going to have Kathy do our poll question. And our first poll question is about why you think, or what variables you think contribute most to the high rate of pregnancy among these different groups. So everybody pick an answer.
I'm going to give you a few seconds here. While they're voting, let's get a few more in here. All right, I'm getting ready to close the poll.
Huh. So most of you put 73% put that you thought that youth desire a connection or are using sex to get close to others. That's really interesting that you all saw that as a big reason why we might have high pregnancy rates. Certainly, parents are busy in their lives, in their work lives. They're managing often several jobs. They may have family members or children in different homes as a result of not being with their particular partner of their children. So they're spread out trying to really manage all the child care needs that are there. So that is a contributing factor. So is becoming a parent. In some cultures, being a parent is probably the most important thing you'll ever do in your life. And, you know, we share that that's an important role in society. We're just hoping that teens will wait until they're a little bit older before they become parents. But that is, because that's such a value, that can contribute, as well as the media depictions of sex in general, but even among these particular populations. But we, like you, really believe that that desire for connection was going to have a big impact on teen pregnancy. And so part of that, piece of that, is that we thought that these youth are often disconnected, not all of them, but sometimes in these populations, youth are disconnected either from society or from their own families. And that disconnection makes that drive for connection even stronger. So, for example, if someone's in a poor kind of community with no resources and their schooling is not very good and they don't see a lot of prospects in their future for success, and are discriminated against or have other kinds of social ills affecting them and their communities, they're kind of disconnected from the larger society and the promise that America gives, and so that can make them try to find ways to show their worth or to be connected. There's also a lot of immigrants and refugees coming into our country, and they have left behind not only their countries, but their many family members, sometimes even their parents, and so they may feel kind of afloat. Certainly, youth in the foster care system have been removed from their families, and they feel disconnected from that family and may want to form their own family in order to have someone to love. And LGBTQ youth are often rejected from their families and put out onto the streets, and so they are also afloat. So that may be a major driver among these youth. Now, complicating that situation is that there may be many predators who are looking for someone who's vulnerable and who may take advantage of that vulnerability, including in a sexual or kind of violent way. And so we know that there's statistics showing that often girls who become pregnant as teenagers are involved with partners who are as many as 6 years older than they are. And those are then considered adults, and that I consider predatory behavior of an adult trying to have sex with a 13 or 14-year-old because they have lots more life experience and can be very persuasive. Certainly if someone's and there has been some data to show that people in controlling or violent relationships, dating violent relationships, that part of that control and part of the violence is sexual in nature, and they may be experiencing sexual assault in those relationships. And so knowing how to understand who these potential people are to stay away from, to protect themselves from this kind of control and violence is important. And then we all know now more and more we're becoming aware of the fact that sex traffickers exist. They're lurking on the internet and and just in the communities, and maybe trying to groom youth, especially those who are runaway youth living on the street, or who have been separated from family in some way, and they may be enlisting them in those kinds of activities. So this group is highly vulnerable for lots of reasons, but this predatory piece is something we don't always think about when we're looking at teen pregnancy prevention. So next slide. So the typical teen pregnancy interventions that have been listed on the Office of Adolescent Health website. First, there were 28 in 2010 listed. That was expanded to 35. There will be even more coming out in the coming year. Most of those interventions, though, don't necessarily cover all the things that we've said. They tend to focus more on direct behavior. So our next poll is to ask you which of the following content is not typically included in teen pregnancy interventions.
Okay, I'm going to give you a few seconds to do that. If you'll vote for us. All right, I'm going to close the poll in a couple seconds. There you go, Anita.
Right. So, as you suspected, most of the times we don't talk about how to manage conflict or people who are trying to get us to do things we don't want to, or how to manage those kinds of differences in a relationship in a way that keeps you safe. That's usually not included in teen pregnancy prevention interventions. We mostly focus on how to avoid high-risk situations, or how to use a condom, or how to use different kinds of birth control. We might mention the risks of having sex with lots of different partners and how that might increase the risk of a disease or pregnancy. And so we tend to just focus in on, what is sexual initiation, what is considered sexual, what are the risks involved in oral, anal, vaginal sex, how can we prevent disease through use of condoms, how can we prevent pregnancy through use of effective birth control, what are all those different options. If we decide we want to kind of wait to have sex, how do we deal with different kinds of situations in order to push that decision off, or that timing off. There may be some mention of relationships and how drug and alcohol might impair reasoning or the ability to go through with your goals. There may be some focus on planning for the future, and certainly there's some really good interventions that keep kids really busy and doing volunteer work and building up their skill sets that keeps them occupied and free of these kinds of dangers. The next slide will begin with a few of the things that aren't usually involved in teen pregnancy interventions. Usually we don't spend a lot of time in most of those curricula that are listed on the evidence-based list at OAH addressing the desire for romantic relationships. That kids kind of sometimes come in wanting to know what's healthy, what is love, how do I know I'm in love, how do I find somebody to be in love with, how do I choose somebody who's good for me, who has a good personality, who's funny, who's interesting, how do I find those people, where are they, how do I find somebody that's going to fit with my life goals, how do I get into those relationships that are positive, how do I feel close to people other than sexually, what can I do to feel that level of intimacy and closeness that I desire so much without necessarily having to be sexual. Are there things that we can do? That's usually missing. Next slide. The other category of things that tend to not be in teen pregnancy prevention interventions is kind of addressing those issues from the past, those feelings of disconnection, those trauma histories that people bring with them. They're not necessarily talking about what sometimes people call baggage from the family or baggage from past relationships, or how poverty or discrimination or other kinds of issues have affected their views of relationships. We tend not to focus on long-term relationships, how to find somebody that you can kind of be with for a length of time rather than a very short period of time. And even though as adolescents they may be in and out of lots of different relationships just to get to know themselves and other people and what works for them, we tend not to kind of disconnect the skills needed to have a long-term relationship from their sexuality. We tend to not put those things together, and so there usually excuse me, isn't a lot of information on communication or conflict management. The next slide shows another set of things that tend to be missing, as we mentioned before, about how to kind of avoid predators in your midst. How to kind of think about yourself as a person that needs to be respected, how to set expectations for how you want to be treated in relationships, how you should be treating others, how to detect early warning signs or red flags that a relationship partner might end up being unsafe or violent or controlling, or really be an actual true criminal, and how to detect all types of dating violence and how to get safely out of those in order to keep oneself intact. The next slide shows that the other piece, we might sometimes get into pacing relationships and drawing lines, but that may not be emphasized in many of the interventions. I've not seen anything on the role of brain chemistry and hormones, and that those, along with drugs and alcohol, actually have an impact on youth and cloud their ability to examine someone's match or character. And then finally, how to break up safely. The last little piece that we noticed that was missing in typical teen pregnancy interventions was thinking of your future, so much so that you think about future children you might have with that particular partner. And so we tend not to kind of have them put themselves in the position of the future potential offspring and how their decisions now might affect those folks. So with all that in mind, when we began our study back in 2010 and we were planning for it, we decided to look at a typical evidence-based teen pregnancy prevention program. This was on the list of evidence-based programs in 2010 that Mathematica put on the OAH list, and compare that to a curriculum that would cover all this other information that we've just mentioned, to see if putting teen pregnancy prevention in the context of relationship education would be something helpful for these populations that are particularly vulnerable. And we wanted to do that in a very scientific and careful way, and so we executed a randomized controlled trial, or an experiment, where youth were randomly assigned to conditions, and we recruited youth from the community who were between the ages of 14 and 19. Now, we were doing primary pregnancy prevention for this study just to keep it clean, and so we recruited kids who had never been pregnant or impregnated anyone, who could speak English, and who didn't have cognitive impairments that would preclude giving assent or informed consent. And then we ran sessions over the course of 2 Saturdays each. They would do day 1 of the curriculum on one Saturday, and they come back the next week and do the rest of the curriculum on the second Saturday. So we ran all these clusters 39 times. We ran it, and we called it CHAMPS because it was creating healthy adolescents through meaningful prevention services. And we called it CAMP because it was all day. And we were able to enroll almost 1,450 youth. Next slide. And as I said, they came to camp, and that psychologically got them kind of ready for long days. We would feed them, give them snacks. We had community partners that underwrote the food for it. we engaged them all through the day and inserted the questionnaires, the beginning and the end of the days, and also had about 13 hours worth of instruction time where they were interacting with the curricula. Next slide. And then we followed up with the youth at 3 months, 6 months, 12 months, and we just now have gotten the 24-month data. So but our report's based on that first year after the intervention. So the kids came to camp, and they were randomly assigned to these conditions. 511 of them were assigned to Love Notes, which is a curriculum that we're going to go through in depth, but the point of Love Notes is to educate participants about healthy relationships, decision-making communication, and all around safety, including prevention of pregnancy and sexually transmitted disease that Marlene Pearson wrote. That's a really thorough and big curriculum that she wrote, and what our team did is we've honed in on the key messages in each module and created an evidence-based version that we tested. It's now evidence-based. We created a slightly shorter version to fit into the 13-hour period, and now that is available to folks in this EBP version using the larger curriculum as supplement. Then the next slide shows we assigned 515 youth to Reducing the Risk, which is a comprehensive sex ed program that had already had several studies showing that it was effective in reducing sexual initiation and increasing use of condoms and birth control. And so we used that particular latest version published in 2011 because we didn't start running this until September of 2011. And then the third group, we actually randomly assigned them to another training that was lots of fun that the kids really loved, called The Power of We, that had been created by a local nonprofit that worked with youth to help them learn how to build community. Their neighborhoods, they did neighborhood walks to see what the issues were in their community, to do asset mapping as well as problem identification. They worked together to address community problems during those 2 days. They did artwork around how can we make our community better. They learned social impact strategies, and it did not have anything to do with their self-esteem, relationships, domestic violence, or sex. So it was totally a control condition, but had benefits for this particular population in building their community service orientation. Now, our sample ended up having, even though we reached out to males and females, slightly more females wanted to come to the training, and so 62% were female. Almost the mean age was about 15 and a half to 16 years old. A lot of 9th and 10th graders, some 8th graders, some 11th and 12th graders, some who had just kind of finished high school. But most were in those first few years of high school. 82% were recipients of free or reduced lunch, so we really did target and were able to enlist kids who really were kind of poor. 88% were black, meaning they were either African American, most of that number is African American, and we had refugees in the sample, and most of those were from African countries. 10% of our sample were Caucasian, and 4.3% were Hispanic. We made a concerted effort to reach out to our Hispanic population, which is actually pretty large in Louisville because we're a refugee resettlement site, a major one, and we've got folks who've immigrated from Mexico, but we've also got refugees from Cuba and some other South American countries. But because we alerted the parents that their child might be randomly assigned to a condition that talked about birth control, Both Love Notes and Reducing the Risk did that. Many opted out because of their faith background. So we didn't find any differences. It wasn't that it didn't work as well. It's just we couldn't recruit as many. Next slide shows that most of our youth were urban, meaning that they weren't refugees or in out-of-home care. 9% were refugees. A group that we did not target but that ended up in our sample, almost 17% were LGBTQ in their self-description. And then we had almost 16% who were currently in out-of-home care. They were foster children. And 21% had ever lived in out-of-home care. Another anywhere between 25 and 38% thought or weren't sure whether they had ever been involved in the child welfare system, having CPS come to the house. So these were kids who had had lots of different things happen in their families, and thus they were the kind of population we really wanted to test these interventions on. In terms of the way we ran this study, we did it in community-based organizations on the Saturdays. And so we were in schools, but not during the school day. It was just more, some of the schools had community schools where they opened their doors for programming for their kids after school and on weekends. And so we had several of those schools involved. We had several refugee serving organizations as a part of our team. We had organizations serving foster youth, both private child care facilities as well as our public child welfare agency in Louisville. We had lots of youth community centers, both faith-based and non. Some kids actually just went to churches to get this information, to be a part of our Champs Camps, and some were part of other types of freestanding community organizations. And then we have a thing where we co-locate services for TANF and WIC and other school services in these organizations called neighborhood places. They're all over our city, serving vulnerable families, and we had all of those as a part of our outreach efforts. And the next slide shows a map of Louisville, and you can see the red dots are the youth that were involved, and you see a high concentration in the northwest corner, and that's our city is the 6th most segregated city in the country, and most African Americans live in that area of town where you see the most dots, and then in that area right in the middle of the city, that's the Newburgh area. But you will also see youth from all over, because we have a unified school district with 100,000 kids in it, and so they might go to school in the inner city and live way out near one of those blue lines on the edge of the city, because our county is our metro area, and they might be bussed into those schools, and so they'd find out about Champs and then come in for the weekend to participate, even though they lived in far out areas of the city. And in the south part, as you see, kind of a trail down towards the bottom of the slide, you'll see that's where some of our immigrant and refugee folks live, and a lot of our Caucasian population that tends to have more poverty. The next slide, so what did we find? I think you've got on your, as a handout for this webinar, the recent paper we just published that talks about the high-risk sexual behavior outcomes. And so we did find that Love Notes, that the youth were less likely to have sex once they'd been exposed to the intervention. If they were sexually active, they were more likely to use condoms and other forms of birth control. They had fewer sexual partners, and they were less likely to get pregnant or impregnate someone at that 6-month mark. Overall, when we looked at the whole year, we found that there were only 18 pregnancies, either a girl getting pregnant or a boy getting a girl pregnant in that Love Notes condition. and that was 44% fewer than in the Power of Re. And you'll see the next slide shows a little graph of those differences.
And Anita, this is Kathy. If I can just interject as well, when when we post the recording of the webinar on our website, I will be also posting the handouts that you see in your toolbar or your control panel. I will post those and a PDF of these slides so that you'll be able to refer back to them in case you don't get to look at them while you're on the webinar.
Thanks, Kathy.
Mm-hmm.
So this bar chart shows, I kind of translated the numbers into pregnancies per thousand because that's how those numbers are calculated for states and for tracking purposes and public health. And so if you translate double the numbers basically, because we had about 500 in the conditions, there'd be 35 per 1,000 for love notes. Now in Kentucky, there were 84 per 1,000 pregnancies among African American youth. So this was a whole lot lower than the African American numbers, and we had a high pregnancy rate in general in Kentucky as well. So we didn't find much difference between our typical Kentucky rate in the Power of We or the reducing the risk conditions. They were similar to our state rate, but much lower for love notes. So the next slide shows that now love notes is on the evidence-based list at OAH because of this first randomized controlled trial, and reducing the risk actually was moved to the high level of efficacy because we also found some positive outcomes for reducing the risk in risky sexual behavior, and that was I think the first randomized controlled trial ever done on reducing the risk. So we helped contribute to that literature. And in terms of love notes, there have been other studies in our own team as well as in Alabama that had found that love notes reduced verbal aggression and attitudes about dating violence. So we haven't analyzed that part of our data yet for the CHAMPS project, but it just adds to that literature that love notes can affect multiple kinds of problematic behaviors in youth. So the final thing I want to mention here before I open it up for questions is, why do we think love notes worked? And it kind of goes back to what we were talking about in the beginning of the webinar. You know, the aims of love note you can see here on your screen. Educating youth about relationships and how to pick good partners and how to get out of relationships that are violent or a bad match, and how to plan and follow a sequence of success, which we don't say control your impulses, but a lot of the tasks and the exercises are to help kids think about how to kind of slow things down and think about what they're doing rather than just jumping into relationships and sex. How to kind of keep themselves safe from violence, as well as from pregnancy and diseases, and emotionally safe as well, and help them increase those odds of being self-sufficient and being in a committed relationship that can last through the bearing and raising of children, so that children can have a strong foundation. The next slide shows we've got 3 or 4 theories of change. I know people think, oh, theories, those are so boring. So I won't spend a lot of time on these, but really, we, as I've sat through this over the summer, we were kind of training facilitators in a lot of different jurisdictions around the country, preparing them for execution of this evidence-based version of love notes. And it just kind of convinced me, again, the fact that this theory of planned behavior, that planning and thinking about your life can make a difference. It's kind of like giving the youth the why. Why should I not get pregnant? Not just because I'm young, I haven't finished school yet, but you know, what would motivate me to not do this? Because we found in Kentucky that 1/3 of kids in the youth surveys that we do in our state, beyond the the youth survey that the CDC executes, that a third of youth in Kentucky try to have children. So having a strong motivation or to think about why that's maybe not the best idea is an important thing to hit on, and that's hit on a lot in this particular curriculum. There's a lot of focusing on attitudes about how you conduct yourself and kind of where you want to draw lines sexually. There's a lot of focus on expecting others to have respect for you and to treat you respectfully, and for you to do the same with them so that you can prevent dating violence, as well as that focus on risky sexuality. So we think that, and also teaching them those positive skills, like how do I communicate? How do I keep things positive in a relationship? How do I manage when we disagree? How do I make decisions and plan? And throughout the curriculum, in every lesson, there's 13 of them. Some of them are kind of double the size. But in every lesson, youth have the chance, after they've done particular exercises and games and role plays and lots of fun activities, to write in a workbook that we call a journal what their goals are for themselves in this particular area. Write down their intentions, share them with their peers, and then after each session, to share what they're learning in love notes with a trusted adult, someone in their lives who's an adult who they can tell these kinds of important things to ask questions of, to get reinforcement. We think that's an important component of this theory of change. The next theory is cognitive behavioral. We're kind of helping kids slow down and think about what are the patterns you get into. What has happened in your past or that happens in a daily life, the stressors that hit you, and how does that affect how you think and how you feel and how you behave in relationships, and how can we break that down to slow down that process so that maybe we think a little more and don't act just on our impulses or our feelings, and slow things down so that we can not end up in situations that will be harmful. What can we keep from our families and what can we let go so that we can improve and do better? And then to think about what have I experienced in the past and how do I want to maybe do differently in the future so that they can kind of do that understanding of how they operate. The third theory is, again, as we mentioned, through the eyes of a child, is a module that we pick up the theme periodically throughout, but in the end it ends with think about any future child that you might have as a result of this or other sexual encounters. Do you want to, do you foresee yourself having to deal with this person for the next 18 years, either in forming a close, long relationship or in co-parenting, and trying to get resources from this person if you think it might not work? And then what is the impact of all that on a child, this relationship, and others that I might have on their well-being? And so there's lots of video and films and music that kind of helps kids think about life from the perspective of a child, and are they ready to be that parent? Then finally, we've included the most up-to-date theory of dating violence, the Michael Johnson model of intimate partner violence, that really looks at two different types of violence, situational and coercive control. We find in the literature that situational violence is very prevalent in teens. Both males and females can be violent in relationships at that age. Usually situational violence is a result of impulse control problems, not knowing how to resolve conflicts, and maybe having anger management issues, whereas coercive control is what we typically think of as that predatory, pathological person who's trying to control another person in every way possible that can ultimately lead in death. So Both kinds are dangerous, especially for girls and women. But we kind of talk about all the ways that violence and control can manifest itself, so that kids can learn about how not only to get out when the warning signs are early on, but if they end up in a relationship like this, how to get out in a safe way, which differs for the different types. And then finally, the way Love Notes is delivered. There's a little bit of didactic information. It's all based in research. There isn't a piece of information in this curriculum that doesn't have a research base to it. We created a slide deck that helps the facilitators stick to the main points and do the critical activities that will help reinforce the learning for the youth and make these facts come alive. It's very engaging and it gets the kids talking, and we poll them, and again, they have that time to work in their workbook and think privately about their thoughts and then talk to their trusted adult. There's lots of games. There's the use of art. You can see here a picture of a particular creation a team developed in one module of the curriculum. There's use of music videos that pick up on the themes of the curriculum. There are films that are made by youth for youth about different situations in sexual situations and how those play out, and role play exercises. So the youth are very engaged. It's a lot of fun, and we think all those things together are what made this a successful intervention. And that concludes my thoughts, and I guess now we'll open it up to questions.
Okay, so if you would just write down your questions in the question box that's over there in your control panel, and Kathy will read them. We'll pick those out that seem to represent the full scope of your all that you want to know. Are we getting any questions, Kathy?
Yes, it looks like we just had one pop up. Were there differences in outcomes for boys and girls? Barbara would like to know.
No, we didn't find any differences. We actually, in our analyses, controlled for gender, age, race, and group like refugee, foster, urban, and we didn't find any differences along those lines.
Okay. Rebecca's asking, did you ask the youth that participated any participant satisfaction questions specifically about the curriculum?
Yes, we did. We had a training satisfaction questionnaire, and actually all three interventions, the Reducing the Risk, Love Notes, and the Power of We, were seen very positively by the youth. So, for example, in a scale of 15 questions, 1 to 5, the potential highest score is a 75. The average score on the liking of the curriculum was 66, which is like 4.5 on a 5-point scale. So routinely and uniformly high across all the 39 executions.
Okay. Yeah, this next question I think we need to go back and talk about a little bit. To clarify, Love Notes program compared to the other programs. Lori asked, she's curious of why the curriculum does include a condom demonstration and practice.
Oh, it doesn't. I'm sorry. We do talk about condoms and birth control, but we don't do demonstrations. It's just there's a module that briefly alerts youth to the fact that if they ever do become sexually active, whether now or when they are in a committed relationship later or when they're married, that here are the options available just so that they understand what's available and how it works and the effectiveness, but we did not do a condom demonstration. We did that in reducing the risk.
Okay. I
That
hope
was the
that
difference between the two.
exactly. I hope that clarified that for you, Lori.
Sorry.
No, you're fine. Lucy would like to know, would this be considered a comprehensive sexuality education program or abstinence plus?
We did not emphasize, abstinence is not the emphasis. It's actually sex positive. It's just putting sex in the context of relationships and the benefit of being in a relationship with someone rather than kind of the alternative of not knowing somebody and all the consequences that can happen as a result of not knowing somebody very well and having sex and what all could happen. It's comprehensive in the sense that the youth understand how the love chemicals, how their bodies are changing as a result of liking somebody or feeling attracted to someone. They are learning about how that affects their reasoning, their judgment, as well as their sexual, desire. And they learn, there's some exercises about if you want to move forward on that, whatever, but if you don't, if in your lifelong plan you'd like to get through high school and college or some technical training before you have kids, or if you just want to wait to have sex, how to kind of slow that down and get out of that situation if you're feeling those feelings. And then also teaches them, if you decide to have sex, here's how to prevent pregnancy, disease, and heartbreak. And so they do learn the different ways of preventing disease, which condoms, the types of condoms that work, and then birth control. They're introduced to that information. We also teach them about anatomy so they can understand how the body works and how reproduction happens. We included a film. We did some adaptations to the earlier version of Love Notes, and that was one of them. We added that film so they would understand the information they were getting. So it's comprehensive in that sense, but the emphasis is just a reframing and an emphasis on not just the how-tos, but the whys and in the context of relationships.
Okay. Irene, did you want to speak on just the regular Love Notes and how some abstinence-based programs use it, or did you want to speak anything about that, or no?
Do you have a particular question that's stated here for
No,
that?
I was just kind of following up with Lucy's
Yeah,
question.
because Lucy was saying that is it kind of abstinence plus?
Abstinence plus. The Relationship Smarts Plus program is very similar to Love Notes, but it is, I would say, a step away from the emphasis of as much sex education and would fit nicely with an abstinence-based program. But there again, it has the emphasis is on that relationship and reasons to pace yourself and not get sexually involved as quickly as our young people sometimes are asked to do. And it gives, again, the reasons why. And it is very similar to Love Notes and also can be used in a much younger audience as well. And they can look at that. There's also evaluations of that on our Relationship Smarts program page on our website.
Okay.
And I know that some people may have gotten those SRAE grants, which is sexual risk avoidance. And the reason Love Notes fits that is because so much of the time is spent on all these other aspects. And if you word things appropriately for that particular RFP in delivering the training, and there'll probably be some adaptations to make for the grantees who got that grant, to make sure that the language is about focusing on marriage as the ultimate goal, putting all the information in the context of when you have sex during marriage. So it can be easily adapted to that because of the emphasis on relationships and skill building.
Okay. I think this next question I think is pretty important. It says, Aletha, I believe you say your name. The results sound great, but the program is pretty time consuming. Have you or are you examining the efficacy of shorter versions of the program or identified key activities of sessions that are most strongly related to your outcomes?
We're going to see if we can, because we've got information about, well, I think with our current data, it's going to be difficult to tell what was most important. We have kind of ratings of how the youth were engaged from an observer during the sessions, but it's very difficult to kind of tease that out. In this first study, we didn't do that. That would have to be future research. Same thing with shortening it. The issue is it just takes time to cover so many kinds of concepts, and I'm not sure what it would take to do that, but that would probably be another research study that would need to be done.
Right, and I guess what I was thinking about too, Anita or Irene, either of you can correct me, is that the EBP model is a shortened version that works from the original Love Notes.
Yes.
So you're talking
Yes.
about 12 hours, and my question would be to reduce it any more might not have the outcomes. The outcomes may not be, or probably would not be the same as it is if you're talking about dosage and time,
Right.
and time between the week between the time that the students actually get the material. Because if you spread it out longer, they're not going to get it, as close together. That's kind of what I was thinking.
Well, we don't mind if people. We don't think that we delivered it in this short time span for the research to try to get it in so we'd have high dosage, but we're encouraging people to spread it out actually so that the impact will last longer than 6 months.
Mm-hmm.
So spreading it out, once a week or a few hours every week for 4 or 5 weeks or across several months is not a bad idea because there's more time to talk to trusted adults. There's more time to kind of think through, work through the workbook. So that how you divide it is not as important as making sure that everything's covered. So 13 hours can be done lots of different ways.
Right.
But that's a good point, Kathy. Thanks for prompting that.
Okay. Another question, I think to follow up, I'm sorry, I lost my place right here, to follow up on something else Lori had asked. And I just think this is really important to, especially for those of us that are so health science minded, is her question was, how can Love Notes be effective at changing condom behavior, yet you're not demonstrating condom skills? She says it doesn't make sense to her based on what she knows about behavior change. So,
okay.
Can you?
Well, they said they were using condoms, so that's all I know. I know that when we asked them, their condom use went up, and so, I don't know how they're learning how to put it on. We also, when kids ask questions, we answered all questions.
Right.
In all the curricula. I mean, the two that were focused on sex, not the control. And so, kids may have asked that, and some that might have been mentioned, but that's not part of the curriculum. I'm not sure why that happened, but it was just as effective as reducing the risk in terms of use of condoms.
Mm-hmm. Well, and I wonder if that was because they got the bigger picture of relationships and they didn't want to have a child. I mean, all of that information that's in Love Notes, that helped them to want, if they're going to have sex, want them to use a condom. Does that make sense, Ray?
Yeah, and I would say too, the emphasis on the development of their self-concept.
Exactly.
That they are beginning to really identify with who they are, what they want, and how their behavior can influence the outcomes of their life. putting it all together, which may have quite a bit of influence on their condom use. And I don't know, I'm sure they can find somewhere on from
YouTube.
somebody, a trusted adult, or in some ways in the curriculum as to efficient and or effective ways of using condoms.
Right. And it brings another question that Elena is asking about, were medical doctors ever brought in, or did they ever look over the information to guarantee that was all medically accurate, especially for parents
Yes.
to know? Okay. Especially
Yeah,
to know
that's
parents will know that their child's getting accurate information.
oh yeah, oh everything was accurate for sure. It's just the timing of how much time was spent on each concept.
Right.
So yes, we went through a medical review. Both we had a medical doctor on our team, a pediatrician, and it went through the OAH medical review, and it's gone through it again
Mm-hmm.
in anticipation of more sites testing it out with OAH, and I'm sure it'll go through it a fourth time for the FISB grantees. So
Right.
it is solid.
Exactly. Okay, another question. And I'm going to keep going because they're great questions here as long as people want to hear them. Patricia wants to know, how did you engage the faith community? I know you talked a little bit about
Oh,
the Hispanic
yeah,
community.
yeah. So the African American churches in our city, most of them were quite excited about the possibility of their youth learning about relationships and healthy sexuality and how to prevent disease and pregnancy. And so many of the community centers at some of our larger churches serving African American population welcomed us in, and they learned, they became facilitators for us and helped deliver the curriculum in their sites. Um, and we've had a long history of working in the community on different kinds of programming, and so our team is very well known and trusted, and we've worked with faith-based as well as other organizations for many years, and so I think that trust helped to open those doors for this particular project. There were a few that didn't want us to do the project there because of worries about talking about sex at all or condoms and birth control, and so we didn't go to those. But parents were also pretty excited, even though they knew the kids were randomly assigned and might get in different conditions. They were bringing the kids to the sessions, and we have surveys of 500 parents, kind of their impressions of things. So we haven't analyzed that yet, but we will.
Okay, great. Go ahead.
Kathy, can we make this one last question for this afternoon, maybe about the Latino families?
Yeah, and she just answered that, actually. She said,
Okay.
did you systematically gather information from parents more
Yeah, I
broadly
mean
to assess their...
the Catholic community doesn't like people to talk about birth control. So in our city, many of the Hispanic Latino families are Catholic.
Okay, and that was actually stated by the next question, Lucy wanted to know, that was actually given as a specific reason for not allowing their children to participate.
Right.
Okay. All right, great. I think we've got most all the questions. I will tell you, if I didn't get to you, I know a couple folks I didn't have time to type back directly to you, that we will have a staff person get in touch with you too if I didn't get to your question, or there's a couple questions here I felt like it might be beneficial for a one-on-one conversation with a staff person. So we'll definitely be sure to get back with you on those. So if we didn't answer them today, definitely we'll be in touch with you.
Okay, very good. Well, thank you so much, and thank you, Anita, for sharing this valuable information. And it was, I think, very informative, and I'm hoping very helpful to our audience. We definitely will have a very brief survey at the end of your webinar as you log out. And we really treasure your feedback. We try to address everything, as Kathy said, so no one is left hanging. this webinar will be available again in our archives within 3 days. And we're really looking forward to next Wednesday webinar. Can you believe November? Can't believe I'm saying that. But it's teens and pornography, the latest research and findings. Another issue that is very prominent on the concerns of parents and also of community leaders, such as all of you are. So anything else, Kathy, before we end that I did not mention?
No, I don't think so. Just be sure to keep in touch with us. You can subscribe to our newsletter by going to our website. And if you have any questions, please contact me or Irene. I'm Kathy at DiableInstitute.org, and Irene is at Irene@DiableInstitute.org. And thank you so much, Anita. It was very, very interesting.
Thank you. It was fun.
For hanging in there.
All right, bye, y'all.
Thanks, Anita. Bye-bye.